Good afternoon, everyone. My name is Carla. I would like for you to imagine yourself in this particular situation, okay? So you're experiencing the worst abdominal pain you could think of. You rush to your nearest hospital, you undergo a couple of medical screenings, and later that day you're notified that you actually need emergency surgery to remove your appendix. But probably an hour before your procedure, your doctor tells you that they misinterpreted your results and that you actually need surgery to remove your gallbladder. So now let's fast forward a couple of months after your surgery. You start noticing a funky smell and pus coming out of your belly button. So you go back to your doctor and they tell you that you've acquired an infection from the procedure. Not only that, but also you still have a piece of gauze inside of you, claiming that the surgeon probably forgot, that little piece of gauze inside of you. So now you ask yourself, how could have they misinterpreted my results in the first place? Could have the infection that I've acquired from the procedure been prevented? And most importantly, could have the surgical error be preventable? So ladies and gentlemen, this is exactly what happened to my mother a couple years back. So here's the thing. Preventable harm in healthcare is a public health crisis. According to the Centers of Disease Control and Prevention, CDC, it is one of the leading causes of death in the United States. It also counts for more than 250,000 lives a year. This leads me to bring forward my question of interest. What can we do to reduce misdiagnosis, healthcare-associated infections, HAIs, surgical errors, medication errors, and most importantly, how can we increase patient safety? So a potential solution is having the National Patient Safety Foundation, NPSF, to urge healthcare leaders along with policymakers to work collectively to ensure widespread adoption, evaluation, and have greater collaboration among one another. You see, in doing so, we are guiding all this effort to improve patient safety and address preventable harm across the healthcare system. Moreover, by simply implementing a national action plan, this will help us accelerate this process and helps us address this issue in a more consistent manner. So most shockingly to note is that 1 in 25 inpatients actually acquire an infection related to hospital care, which of course this leads to the loss of tens of thousands of lives a year. But by appointing this approach, we have already seen a significantly reduce of infections in the past years. And also, according to a report from the National Patient Safety Foundation, it is said that errors and injuries that occur during care may cause significant mortality and can undermine patients' quality of life. And even with ongoing efforts to improve patient safety, visible improvement is still inconsistent. So this means that some hospitals are adopting these efforts while others aren't. And there's also a lot of finger pointing between multiple sectors. So in order to really achieve patient safety, stakeholders should work together to anticipate risk and uniformly apply coordinated prevention efforts. So now, another potential effort in tackling this healthcare problem is identifying causes and intervention. So in order to do this, a recommended action would be to provide sustainable funding for research and patient safety. So in other words, we need to ensure that funding for research on the prevention of healthcare harm is at a level comparable to research on other top diseases. So for instance, in 2016, the National Institutes of Health allocated $5.4 billion for cancer, while just allocating $0.9 billion for patient safety. So this particular solution will help because we're tackling the root of the problem. So you see, in essence, if we were to ensure proper funding and sufficient funding for research on identifying the causes of these infections, of injuries and errors, we would have the power to decrease mortality rate among patients and thus increase or ensure better quality of life. So medical errors can can occur anywhere in the healthcare system. But even if they are unintentional, they can certainly be preventable. It all begins by creating a centralized and coordinated oversight of patient safety. So initializing a coordinated public health response will essentially accelerate this progress in the prevention of harm and ensure better quality of life. So in addition, by investing money in research that focuses on patient safety and by prioritizing this issue, we will be more than capable of identifying causes and interventions that work. In return, we can minimize and ultimately eliminate certain medical errors and injuries. It is important to realize that each of us will become patients in our lifetime, and whether we're interested or not in this case, we carry the sense of responsibility for improving patient safety within our healthcare system. That will be it. Thank you for listening.